HBM4EU is the Human Biomonitoring for Europe project. It runs from 2017 to 2021 and is providing evidence of the actual exposure of citizens to chemicals by coordinating and advancing human biomonitoring in Europe. The project is coordinated by the German Environment Agency, über. It is co-funded by the European Commission under Horizon 2020. The project has 3 pillars. Pillar 1 on science to policy is led by Vito. Pillar 2 on European HBM platform is led by the Institute of Health Carlos III, ISC III, and Pillar 3 on exposure and health is led by the French National Institute of Health and Medical Research, INSERM. People are exposed to complex mixtures of chemicals in their daily lives through the environment, consumer products, food, drinking water, and at work. Some people are especially vulnerable, such as children, pregnant women, workers, and the elderly. HBM4EU contributes directly to the improvement of health and well-being of all citizens by investigating how exposure to chemicals affects their health through human biomonitoring activities and related research. Human biomonitoring determines an individual's exposure to chemicals by measuring biomarkers, which may be the substances themselves or their breakdown products in urine, blood, or hair. Research activities are already in place at a national level in several countries. However, available data is not representative of the European population, and data from different studies may not be comparable due to the use of different approaches and techniques. In addition, data may be inaccessible, and the substances measured may not be the most relevant when considering chemical risks in Europe today. With the aim of ensuring that the project's research results are relevant to the European public and useful to the political decision-making process, the chemicals have been identified and prioritized for monitoring and research in close collaboration between scientists, stakeholders, and policymakers. Surveys and focus groups are used to better understand public concerns regarding chemical safety. In terms of understanding risks to health, the link between the concentration of substances outside the human body, inside the human body, and the corresponding impacts on health are not well understood. This knowledge could inform targeted and effective policymaking to deliver safe chemicals management. HBM4EU will tackle these research gaps and will make human biomonitoring in Europe more effective, harmonizing methods and sampling, producing comparable data for the European population, and making data accessible to regulators and scientists. To reach these goals, HBM4EU is building a European Human Biomonitoring Platform, including more than 100 institutions and policy institutes clustered under national hubs in each of our 28 partner countries. HBM4EU partners are collaborating with chemical risk assessors and risk managers, including several commission services and agencies of the European Union involved in chemicals regulation. In particular, the European Environment Agency is a partner in the project, contributing its institutional experience in translating science to policymakers. Crucial to the credibility and legitimacy of project output is our engagement with stakeholders, including non-governmental organizations representing environment, health, and consumer priorities, as well as trade unions and representatives of industry. This collaborative approach ensures that HBM4EU generates knowledge that addresses genuine societal concerns and informs chemical policies.